once we've taken you through all those assessments, and now we have a solid diagnosis that you in fact do have postural fatigue syndrome or upper cross syndrome, what we would do is take you through some of our treatments. So the in-office treatments can vary greatly. So sometimes we would recommend dry needling. So that is basically we'll needle very tight spots. Let's say you've got a bunch of trigger points through your neck right in through here. We would lay you face down and apply some needles to some very tight trigger points to relax those and run some current through there to relax all the muscles. So we can also use classic massage therapy. So just have you see one of our massage therapists, you lay face down on the table and they're just doing classic deep tissue or trigger point massage. Some of the more advanced techniques that tend to work a little bit faster are called active release technique or fascial distortion model. So active release technique, in this case, let's say he's having left-sided or both-sided tension and pain here. I would just put my fingers on either side like this, support his head, and follow my lead. And then I'm just going to basically pinch as I flex him like this and work right up nice and slowly like that. Not too hard, but not too light either. It has to be pretty firm pressure to make some progress. So kind of squeezing like this and flexing down. Good. Perfect. All the way to the suboccipitals there. And then the same thing, oftentimes I'll get on the table or just stand behind him here. I'm going to have you do the same exact thing. So just like this, go ahead and flex down. Good. Just like that, flex and round, really slouch. Perfect. Just like that, and come on back. So essentially, one more, pressing just like that, we can get right on the muscles there and stretch them as we're massaging them. And the reason we do that is because it works faster. So it really loosens up the muscles and makes you feel pretty good. So that's a good example of active release technique for postural fatigue syndrome or upper cross. So postural fatigue syndrome and upper cross are basically one and the same, although upper cross has an additional anterior basically problems in the front where your pectoralis minor, those muscles are pulled in like this, and the SCM is tight, so it pushes the head forward like that. So we would also have to loosen those up. So we would get you on your back and work right on those muscles to lengthen them as we're massaging them, kind of push on those muscles as we stretch your arm like that. So those are a lot of the massage techniques we use. Some of the other techniques we would use in the office, of course, is adjusting, like chiropractic manipulation or mobilizations. So for this type of thing, I would usually adjust for postural fatigue syndrome. I would usually adjust in your upper back as well as right at the transition between your neck and your upper back and the suboccipitals to make sure that you've got free motion through all of those segments like that. So we'll address the muscles as well as the joints because combined that tends to work much better than any of those separate.